Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
It's pretty important that the providers say, I'm still here with you. I'm not going anywhere. If someone gets the message that, hey, I'm just sending you to a shrink and you're out of here because I don't want to deal with your pain or your migraine. And that's a really dismissive, stigmatizing thing to say.
Welcome to Talking Head Pain, the podcast that confronts head pain head on. Hi, I'm Joe Coe, Director of Education Digital Strategy at the Global Healthy Living Foundation and a migraine patient for over 20 years. I'm here today with a really amazing person, Dr. Dawn Buse. She's the clinical professor of neurology at Albert Einstein College of Medicine in New York City, an assistant professor in clinical health psychology, the doctoral program at Frankfurt Graduate School of Psychology, and was the director of behavioral medicine at Montefiore Headache Center. She's a licensed psychologist, a former board member of the American Headache Society, and a current fellow of the American Headache Society. I'm really excited to jump into this conversation with Dr. Buse. So let's start, Dr. Buse. Tell me about what drew you to becoming a clinician and researcher in the field of migraine, pain, and stress.
Well, hi, Joe. Thank you so much for having me on. I am a fan of your work and a fan of your podcast. So I feel like I'm talking with an amazing person today. So the feelings are mutual. Now, this is a really fun question. Thanks for asking me this. So back when I was a graduate student and an intern, Jon Kabat-Zinn had published some work on mindfulness-based stress reduction for people with back pain. And I was really excited about that. And as I started to look into mindfulness for pain, I also found Herbert Benson's work looking at mindfulness and relaxation therapies. And he had actually done some transcendental meditation because it was the 1970s. For people with cardiac conditions. And I started to get really excited about the idea of mind-body medicine. So when I was looking for my internships and my fellowships focused on pain programs, I got, really fortunate to have training in the Boston area at some amazing hospitals. And I was at Spaulding Rehabilitation Hospital and had two amazing mentors, Elizabeth Loader, and Dr. Loader is a former American Headache Society president, and Dr. David Biondi. And they just kind of opened up this whole world to me. And then once I got my first job, it was with Dr. Richard Lipton. And that was about 17 years ago now. And I still feel like I'm learning every day. So I've been really blessed with amazing mentors, great opportunities. And I just love working with people with migraine and chronic pain. I've learned so much from people living with these diseases, and I continue to learn from them every day. It's an exciting field, and a lot of great things have been going on in the past couple decades. So it's a great field to be in.
I totally agree. And that segues nicely into the topic that I wanted to dive deep into with you today. We know that therapies like cognitive behavioral therapy or CBT, biofeedback, and relaxation therapies are listed in the American Headache Society's consensus statement of data-supported therapies for migraine prevention. Yet I know, and you know, Dr. Buse, that many patients might feel dismissed when offered these modalities that we know could be beneficial. How do practitioners and researchers talk about CBT and similar interventions in a way that affirms and uplifts people that live with chronic disease like migraine?
Oh, that's such an important question. I think the way that it's introduced to someone living with migraine or chronic pain is really important. First, the way you said it was perfect. You said these are therapies with data, and they're listed in the American Headache Society consensus statement. They're endorsed by the American Academy of Neurology. They're endorsed by the American Pain Society. And so I think if healthcare professionals presented these as data-driven therapies, these are therapies that are guideline approved, that have evidence for prevention, that might be helpful. Also, if they talked a little bit more about the evidence. So when you go back to the traditional oral preventives for migraine, those would be like the topiramate and the amitriptyline. The rates of the efficacy of those types of therapies are quite similar to the rates of the efficacy of biofeedback or relaxation therapy for prevention. And also, both about 50%. And also when you combine them, you get this even better outcome. When you combine a medication preventive and a behavioral preventive, you get even better results, more like a 75% result. And it lasts longer. It lasts beyond the time that the medication stops. So I think if they said things like these can be combined, there's a lot of ways to get to these therapies today, be it in person, in a group, via an app, online telehealth, and that we have evidence that they're helpful, I think all those things would help. I think also these are not as easy as taking a medication may be, in that they require a lot of time. They require oftentimes about 3 months if you went once a week, to about 12 sessions of maybe 45 minutes to an hour session. Plus, they require time in between of practicing, be it practicing CBT exercises, practicing mindfulness, whatever the relaxation practice, whatever practice is given as homework. So they're a bit labor intensive. And I think that it would be helpful for healthcare professionals to say, this is not easy. It's going to take some time. You got to work it into your schedule. You've got to have some discipline, just like any of the other lifestyle factors that we know play a role in migraine management, like regular exercise and healthy diet and maintaining a healthy weight. These sound so easy to say. They are very inexpensive. There's not side effects. And yet these are some of the hardest things for any human being to do. You're human. I'm human. Our listeners are human. The doctors are human. Believe me, they don't have an easy time either with sticking to an exercise routine or practicing mindfulness every other day for 3 months. These are not easy asks. So they are kind of a big challenge, but the benefits may make them worth it.
And what about the emotional aspect that patients might have? I know if I'm in a lot of pain as a migraine patient and my doctor said, maybe you need to talk to someone, I might get offended. I might think that they're trying to not give me medication that I might need. How do you balance the emotional impact for those that might not be driven by the data and the evidence that we all know is there?
Absolutely. So hopefully knowing that these are in the wheelhouse of the kind of data proven therapies might help someone if they do hear their provider say, I want you to try biofeedback, for example. But also, it's pretty important that the provider say, I'm adding this into your treatment regimen. I'm still here with you. I'm not going anywhere. We're going to figure out a treatment plan that incorporates multiple modalities. We're going to do it together. I'm here for you. Certainly, Joe, if someone gets the message that, hey, I'm just sending you to a shrink and you're out of here because I don't want to deal with your pain or your migraine, it implies this, it's all in your head. And that's a really dismissive, stigmatizing thing to say. And honestly, we know that people with migraine and chronic pain, all sorts of chronic pain conditions, fibromyalgia and Crohn's, have been stigmatized and dismissed by their healthcare professionals for the past many centuries. And that may happen today. So people feeling stigmatized and dismissed has a real basis to go on. These have been diseases that have been treated that way. And in some cases, I think possibly when a healthcare professional didn't feel like they knew what to do, they didn't feel like they had treatments to offer, they may be dismissive. So a lot of listeners may have had that happen one or many times already in their treatment journey, and they know exactly what you're talking about. So a healthcare professional can kind of bring in different people onto the team. They could stay as the quarterback, but they bring in some new people. You probably know the different players better than I do, but you bring in some new people to your team and you're really adding on, as opposed to this idea that I'm firing you, I'm letting you go, I'm passing you off to a shrink because I don't believe you. That's a very different message. Joe, and if someone feels disrespected or not listened to or stigmatized by their healthcare professional, I would say move on and find a different healthcare professional. Ultimately, that's a relationship. You are both the customer as well as someone in that relationship, and you deserve to be respected and listened to.
It's really important. I'm glad that you highlighted that. It's super impactful for patients to hear clinicians and providers and professionals talk in that way, because sometimes we don't have the luxury of meeting folks like you that get it. And in terms of football, I know what a quarterback is and a kicker, because we have a former kicker from college football at GHLF. So I know about kicking and quarterbacking. So we probably have the same football knowledge.
Awesome.
I want
Awesome.
to switch gears a little bit and talk about wellness and migraine. Dr. Buse, when we talked before the recording, we spoke a little bit about my wellness journey as a migraine patient, how it's impacted my migraine disease for the better. I currently exercise daily, either through walking, sometimes a little jogging if I'm feeling a little adventurous, or strength training. I got into a healthy range of weight for myself, and I eat a much more balanced and nutrient dense diet. It could seem really overwhelming to make these changes at first, and it was for me, and I didn't do them all at the same time. What are some tips that you can provide to people to make these big life shifts easier?
Well, Joe, congratulations. And that's not easy. So, really well done. That's wonderful. And you actually already included several different tips in what you just said. You didn't do it all at the same time. So, choose one, maybe two, but choose one kind of life modification to start with. Start where you are. It's really easy to compare ourselves to people who are already running a marathon and they're in our Facebook friend list and we see what they're doing and we might feel judgmental that what we're doing is not enough. Any place you start is valuable and is enough. So be gentle with yourself. Start where you are, make a small goal. And I like to set goals once a week and just keep building on them. If you make that goal, set a small, doable goal. We actually talk about SMART goals. So they're specific, they are measurable, they are acceptable, they're realistic, and they're time limited. So let's talk about exercise. So let's say someone doesn't move a lot yet and has a lot of pain with movement and maybe is carrying more weight than they want to. And maybe they have joint pain and a whole bunch of reasons that they have kind of stopped moving. And that lessening of movement or exercise in their life didn't happen overnight. That probably took years. And the moving that around, turning that around is also not going to happen overnight. That's going to take some time. So for the first week, it might be something which may sound simple to some people of walking down to their end of the driveway and picking up their mail and walking back to their house. And some people may say, oh, that's not even worth a goal. It is. That may be your first goal, whatever it is. And then you'd reassess the end of the week and either you'd kind of stay with that. If that was too hard, maybe you'd bring it down a little bit. If you accomplish that, you're going to bring it up a little bit. So you're going to adjust it every week. But I don't want you to judge yourself. Any step you're making towards a healthier you is absolutely valuable. And I don't want other people to judge you either. We want to surround ourselves with people who uplift us and support us, be they virtual, be they in a podcast, be they in a support group, be they IRL, in real life friends and family. We can't always choose who we're related to, but we can choose who we kind of share things with and who we spend time with. So you need a group of cheerleaders around you who are going to say, go and you got this, and maybe even someone to do it with. So having a buddy in these life changes can be really valuable. Someone you trust. It may be a friend, it may be a family worker, maybe a coworker, or it may be your dog. Your dog may be your walking buddy. Your dog may be your personal trainer. So maybe your first step towards movement is that every night after dinner, you tell your partner, your spouse, that he or she's going to do the dishes because, Dr. Dawn and Dr. Joe said you've got to walk with your dog around the block. And that's your next step. So in addition to that, you got to make it work in your schedule. It sounds so simple, but if we don't make time for it, the day flies by every day and we wonder, where did the day go? And we don't have enough hours. So it really needs to be into the schedule. And that's why I said, every night after dinner, or maybe you're a morning person. So maybe you carve out a little bit of time. And to do that, maybe you have to rearrange your family responsibilities or your childcare or your spouse or your job and say out loud to people, I am starting to walk. And so I need help with you getting the kids ready to school in the morning because I'm going to take a walk around the block. So you start to get more of your family, your coworkers, your team on board, make them part of this journey, give them a high five when you reach your goal because they helped by taking off your plate whatever you needed. You get a high five. And I just want you to be gentle for yourself. So start where you are, start low and go slow. Build up, surround yourself with supportive people, bring someone in as your partner, and then kind of just keep reassessing as you go. But whatever you do, it's of value. So just be proud of yourself for everything that you do to move towards that journey. And you should be so proud, Joe. Wow, you accomplished quite a few hard things. Weight loss and exercise are some of the hardest things that humans ever have to do.
Yeah, it's been a wild trip. And two things, Dr. Buse, that you brought up that I think is so important. Early on, I was working with a friend who was starting a health coaching practice. And the first couple of weeks, she had me just focus on water. And I thought it was kind of silly. I'm like, I drink enough water. Why do we have to just focus on water? I want to do the quote unquote real work. And we focused on water. And one thing that she told me to do, which I thought was so silly in the moment, and now I tell people this all the time, was when I drink water to cheers myself, to say, cheers, you're doing something good for you by just drinking that water. And I drink a lot more water now. And we moved on to different things once we tackled water. And it was a very slow and steady process, like you said. And I increased it as we've gone on.
I love that. So you took that moment to stop, acknowledge, and celebrate. I made a good change. Whether you're high-fiving yourself or your dog or your personal trainer, that you took a moment to say, wow, we did this. This is good. On to the next step. I love that. I think it's so easy for us to just kind of write off and brush off everything we're doing that's going well and everything we accomplished that was hard and focus on the things that aren't going so well. So yes, focus on what you did, what you accomplished, and celebrate it a little bit.
And then the blocking of time to make ourselves a priority. And I have to acknowledge that I'm very privileged in the sense that I have a workplace that is super accommodating and I can block out segments of my calendar and say, this is when I'm working out. And I treat it like I would a doctor's appointment. It's blocked out. I don't take phone calls. I don't multitask. I was doing a lot of that at first when I was going on walks and I was taking conference calls, and someone said, you might want to be more in the moment when you're doing this. And I said, that makes sense. So I made it, like you said, Dr. Buse, a team effort. People on my team, people at GHLF know that when that is blocked out private, that could be a doctor's appointment, that could be Joe going to the gym, that could be a walk, that could be all of these things. And it makes me such a happier and more productive person to have that flexibility and ability to do that for me.
I love that. So you said two more important things in there. You talked about the importance of time management, but you also started with a caveat. You said, I am privileged that, and I'm going to say, I am privileged that even though I have two young children, they're in school and I have childcare help. And I have my parents, their grandparents who live nearby, and I have a supportive partner, and my list goes on of privilege. All of those things can make these actions easier. And there's going to be people listening who don't have any support, who don't have, be it childcare or elder care or senior care, who don't have the privilege right now financially, who maybe are struggling financially, whose health isn't at a place where it's easy to start any of these, who don't have the social support, all those things. So while these things sound so simple to say, yeah, start exercising, drink a lot of water, there are challenges that everyone faces. And we're not in the same boat. We're in different boats. Some people are in yachts and some people are in a rowboat with two oars, and some people are in a rowboat with one oar, and some people are in a rowboat with no oars. We're in very different places. So we always need to recognize that some of us are privileged to have a bit more support and opportunities that other people may not have. Nonetheless, you and I are still going to try to encourage everyone to figure out ways to make it work in their life the way their life is.
And that's really key. I want to also let the audience know that as I started to get healthy, as society would define health, I was having more attacks. I was getting off of one treatment that was lowering my heart rate a lot, which was making exercise interesting and difficult. I was passing out a lot, and that was also increasing my attacks. I also suspect, and there might be some science behind this, that even positive things like exercising and doing things that your body isn't used to when you have a hyper excitable brain and migraine might have been a little funky for me. So I started to get angry and frustrated that, like, I'm doing all the right things. It's been for months. Why am I still having all these attacks? Why am I not loving working out? I hear everyone's like, oh my God, you work out, you feel so good. I didn't for a very long time. I do now, and I understand that. But it took me a long time to get there. And I really needed to trust my neurologist, my cardiologist, and the fitness coach that I was working with to guide me in that process. Why do you think, Dr. Buse, it's important to view wellness and health as a dynamic journey and not a linear one?
Wow, Joe, that is a great insight. And I'm so glad you're sharing this, because if you didn't share this, a listener might go through the same experience and think, oh, I've totally failed, or this is terrible. I shouldn't have even continued this. I shouldn't have even started this. So sharing this experience is really important. Your experience is more common than it just going smoothly, in fact. So we can start, because many of our listeners may have migraine or other chronic pain conditions, or may love somebody with migraine or chronic pain conditions. As you said, the nervous system of someone with migraine just loves consistency, everything being the same. So even if it's not the healthiest of patterns, it's going to want to stay with that pattern. It's the pattern it's used to. And any change in any direction seems to be something that can increase migraine activity. So interestingly, when it comes to stress, not only a rise in stress for a prolonged period of time, but a drop in stress may trigger increased activity. Less caffeine, more caffeine, less sleep, more sleep. All of these changes, even though we can say, okay, well, less stress and less caffeine and more sleep. Those are good. Those are good. We want to do those things. Well, the nervous system at first may revolt a little bit and say, this is a change, and you may see a little bit more migraine activity. But I and Joe want to kind of encourage you to push through that phase and know that, in fact, these kind of half a dozen healthy habits that matter really do make a difference in migraine management. They affect the hypothalamus, which is part of the place where migraine attacks get started and get regulated. These do matter, but you're going to get a little bit of that hump, and it may feel like 2 steps forward and 1 step back, or it just may feel like steps back. It sounds like for you, it just was like, oh, this is just worse. So please have faith that scientifically we know this is the right direction and kind of move past that. And really the trick in kind of healthy habits, they're a long game. This is a marathon. This is a lifetime change. So just because we slip up one day or 1 week, in fact, I feel like we deserve a break 1 day of the week or 1 week of the month. For example, say we're trying to eat healthy and we end up eating, 1 cookie out of the box. Well, we just want to say, okay, we ate a cookie and back on track. Nothing is wrong with eating 1 cookie, but we don't want to say, I've totally messed up here. I'm just going to eat the whole box and another box and a tub of ice cream because it doesn't matter. We just want to kind of recognize when those step back happen and just stay on track. And that's the definition of resilience. Resilience isn't smooth sailing. Resilience is when you get knocked down, you get back up. And you just have to get up more times than you get knocked down. And people with migraine are good at this. They get knocked down all the time. They have these relentless waves of migraine attacks that never stop coming. Migraine, unfortunately, is not a curable condition, but it's much more of a manageable condition than it ever was before. We know more. We have better treatments, pharmacologic and non-medication treatments. We can manage it better than ever before. But people with migraine are pretty used to this, like the challenges keep coming, the waves keep coming. And that's where I like the quote by John Kabat-Zinn, who says, we can't stop the waves from coming, but we can learn how to surf. So a lot of life with migraine or other chronic illnesses is learning how do we make our surfboard? What kind of keeps us going? What is our purpose, our meaning, our happiness, our joy, our healthy habits that keep us going? And those are what we need to identify.
I love that on so many levels. I had 4 cookies today and I feel great about it because it's about what you make more choices than not. So today I chose to have 4 cookies. Most days I'm not having 4 cookies. And I had some setbacks recently that really made me think about these breaks. I had COVID in June, so I couldn't exercise for a little bit. Then I had an appendicitis attack and had surgery and really couldn't exercise for a bit. And I was so nervous that this was going to throw me back to where I was 2+ years ago. And the same could be true if we start having really bad migraine attacks again, that we think that moment that we have to stop is going to change all of the positive change that we've had. And I learned that it's really a shift and, like you said, a marathon. And I had to slow down. And it was a really good opportunity for me to explore what it meant to slow down, what it meant to think about this as a long game, as opposed to, okay, well, this is a month. But you're right. I didn't become inactive in 1 month. I became inactive in 10 years. And I didn't become active in 1 month. I became active in 2+ years. So 1 month is a big chunk of time, but it's also not a big chunk of time. So we can sit with that and provide space for those feelings. And I think that's so important to be gentle, as you said, Dr. Buse, with ourselves. So thank you. Are there any other evidence-based wellness practices that you think our audience should know about?
Yes. So fortunately, they only fall into about half a dozen categories. It's not a laundry list. We've talked quite a bit about exercise and movement. Wherever that is, wherever you start, just that it's regular, about every other day, maybe more days than not, it is important to have some movement. If you can do every day some movement, that's great. When it comes to diet and nutrition, You talked about drinking water. That was actually a good place to start. Staying hydrated with healthy hydration is important. We need more hydration than we realize. And for some people, dehydration can be a trigger for migraine activity. It might increase more attacks or it might increase kind of the severity of the attack. So staying hydrated is pretty important, as well as a healthy, balanced diet. And we've heard so much information conflicting about what people with migraine should eat, should avoid. Well, scientifically, it's looking like it kind of comes down to a low inflammation diet, which means a balance of healthy fats, just lots of natural fruits, veggies, unprocessed food. So thinking about a diet that's a little bit more back to nature and balanced. And it does not have to be difficult or specific. We just kind of stay in the healthier zone. In the grocery store, stay in that outside area where the fruits and vegetables and the unprocessed proteins are and get more of those than we get of the treats. I mean, I had my pumpkin spice latte this morning, so I'm with you on a little bit of treat makes you happy. That's okay. But just the balance. You talked about the balance, Joe, and it all comes down to balance and portions. Social support is really important to getting through with any chronic disease or any challenge in life. And as I said, we can't always pick who we're related to, but we can pick kind of who we share with, who we spend more time with, and we can create family support and friend support out of our communities. And you've created an amazing migraine community, and other really supportive migraine communities exist around the world, across the country. There's a lot of places to reach out and find people who are like-minded and supportive. Or it may not be in a migraine group. It may be another group of people who want to start moving and exercising, or other kinds of stress management approaches, or kind of connect to your passion. What is your passion that has nothing to do with any of this? What brings you joy? What do you care about? Do you have a hobby? Do you have a devotional activity you care about? Do you have a volunteer activity you care about? Getting outside of ourselves and focusing on others, even when we're having a rough go of it, actually can be really therapeutic. So that support and kind of focus on what brings you joy. And then stress management. And that can come in so many shapes and forms. And unfortunately, we can't control what happens to us. A lot of the times we can only control how we react to it. But it's that how we react to it that's what gets our physiology going. It's what it means to us that gets our fight or flight response up. And how quickly do we counteract that, be it breathing, be it refocusing, be it exercise, be it biofeedback, meditation, taking a walk with our dog, cooking in the kitchen, spending time with friends, looking at the ocean, whatever it is for you that kind of calms your nervous system, brings it back down. That's important. So these are the areas to think about that the nervous system really does well with. Consistency and those basic healthy habits, which sound so easy, they're not so easy. And you've shared some really good strategies, Joe, for kind of navigating that path. But those things do matter. And even if you are taking medication, a daily medication, an as needed medication, or using neurostimulation, these will actually get a better result from all of those when we've got these things lined up.
I think it's so important for people to hear that. I don't think people hear that enough, that your medication might or probably will work better if you're doing these other things. It makes sense, but we don't hear it a lot. I take a medication when I have an attack, prescription, and I'm on a prevention medication. I'm still on those while I'm like super healthy because I need them. Like you said, you're not cured from migraine because you're doing all these things. Some people might be not cured, but in remission, for lack of a better word.
Right.
Something
Absolutely.
that we both talked about in different ways that I want to highlight as a concept was habit bundling. So you talked about how you would recommend or give a tip to someone to go for a walk after dinner, something that you're already doing, and bundling like one of these positive activities is a way that I have found to be really helpful. It's one of the ways that I increased water initially. I would wake up and I would keep water right by my bed, and I would wake up and I would have 30 ounces of water, and then I would go brush my teeth. So brushing my teeth was the habit that you had, and drinking the water wasn't the habit, but I connected the two. And now it's like, before I go to bed, if I'm like, I need my bottle of water next to my bed, it's like I don't feel settled if I don't have my bottle of water next to my bed. And now wake up and I have 30 something ounces of water a day, which is like a great way to kickstart it. So I think that those things I tell people, like, figure out what works for you, what works within your life. We all are doing things on a repetitive motion. We're all eating dinner at some point. We're all brushing our teeth. We're all going to work if we're able to work, if we're, not on disability or retired. There are things that we can do that connect to other things that make these lifestyle shifts a little bit easier.
I love that. Those are really good suggestions. Those are really, really good ideas. And thank you again for highlighting the fact that these healthy habits are not only going to help you kind of generally feel better, help your body function better, is you may get better results from any treatment when you've got these underway. And I actually didn't mention sleep, and sleep. Getting regular restorative sleep is really, really important to all functioning. Again, this may not be easy for so many reasons. You may wake with pain. You may have small children at home. You may work a different shift. You may live in an area with noise and light outside. There's so many reasons this is not easy, but think about where you are. Think about what you can do, any tweaks you can do to prioritize getting restorative sleep and trying to stay on a schedule as much as you can, given all the aspects of your life, is also valuable.
There's so much we could talk about, but this is our last question. Thinking about future research, what are you most excited about?
This has been an amazing decade in our understanding and treatment of migraine. So if we go back to the Egyptian hieroglyphs, which have migraine in them and aura, and the idea of, treating people with an electric eel to the head, which has really come full circle with neurostimulation, we have come so far in what we know in just the past 10 years. This is a really, really good time to feel optimistic for people living with migraine or people who care about people living with migraine. You may have children with migraine. You may have a partner with migraine. You may just worry for the good of humanity with 1 billion people with migraine around the world. So we're learning a lot about kind of the scientific aspect, like what neurotransmitters are involved and genes. And we're learning a lot about the social aspect. We have recently done some really big studies of stigma. In fact, in our Overcome study, we surveyed 60,000 people with migraine and 100,000 people without migraine to find out how they felt about people with migraine. And we have some amazing new stigma data that we should talk about sometime soon. So we're coming at it from every angle. And for people who have not gotten benefit from the newest treatments, because there are people who've tried everything new and still didn't work for them, and my heart aches for them. No one has given up on you. So scientifically, we're still working on new targets for treatments. So going beyond CGRP to the next neurotransmitter, the next molecule. We are still working on treatment matching, like looking at genetics, looking at comorbidities, looking at all sorts of factors of the individual to create this, what we call a phenotype, meaning we put together a bunch of these variables and we say, oh, okay, this person may benefit from this. So no one is given up. Everyone working in migraine is really excited, from the doctors to the scientists to the patient advocates. And we're going to see more and more understandings, treatments, and better outcomes coming down the pike. So it's just a good time for people with migraine. And there are so many reasons to be optimistic and hopeful and excited about the future right now.
I so agree. And I'm definitely hopeful. And this conversation also provides a lot of hope. And I really appreciate your caring, compassionate approach to talking about research, which can feel very cold and not connected to people often. As a patient, research can seem scary. So you really demystified a lot of that. And it was a really robust discussion. Thank you so much for joining me today.
Thank you, Joe. And I think what you do, sharing your experience with listeners, is really, really important, because a big part of stigma is feeling alone, or that you're the only one, or that you're a loser. Why doesn't it ever work for me? And by saying, oh, this is what happened to me when I started my wellness journey, or this is what I experienced, people realize they're not alone. And there's great comfort in that. It gives you a roadmap and a path to feel confident that you're kind of on the right path. So thank you for all of the important work that you do.
Thank you so much for listening to this episode of Talking Head Pain. the podcast that confronts head pain head on. If you like this episode, please give it an honest 5-star rating and subscribe so you never miss another one. I'm Joe Coe, and I will see you next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.